All right, welcome back, everybody. Understanding ADHD, particularly when it comes to children, it can be a really difficult thing to do.
It's a topic that comes up a lot in our Channel 3 Mom Squad. So what should you do if you suspect that your child could have ADHD? Joining us now with more is Dr. Laura Saunders. She is a child psychologist at the Institute of Living in Hartford. Welcome, doctor.
Hello, friends, and happy Wednesday.
Happy Wednesday to you.
So let's start with, this is getting talked about a lot, and even on social media. I don't know if we're just noticing it more or we're diagnosing more, but there is some negative news that if you don't get your kids diagnosed and get them what they need, there could be trouble down the road. Is that right?
Yes. So there was some recent research came out, highlighted and published through the American Psychological Association that looked at, actually it was a replication of a study done in New Zealand in the US and UK population, looking at those who struggle with attention and behavior problems generally tend up earning less, finishing fewer years of school, and have poor mental and physical health long term as adults.
Why would they, well, I guess I know the answer to this, but why would they be earning less? It's just that they can't hold jobs longer, or is something along those lines?
Yes. So, I mean, it would be a combination of things, that they don't have the skills to sustain in a job. They have negative educational experiences and therefore don't, continue in their education. And we know, I mean, it's pretty well documented that the sooner you stop your education, the less your long-term and lifetime earnings will be. So if education and academic experiences are not positive for you because of a lot of negative feedback, you're going to quit or drop out as soon as you can, and therefore you earn less over your lifetime.
Interesting.
Yeah. But I mean, the thing is that now, hopefully, some schools are becoming much more aware, and there are interventions which can kind of turn the tide in the right direction. Because there are also people who've been super successful in life who say that their creativity and their spontaneity and all that is partly due to their ADHD. So what do you do if you suspect your kid has ADHD?
So the good news in this is that, yes, you can harness some of those, what could be deficits, but you can harness those. So the good news is, some of these research findings really make it clear that children can develop skills, but it is critical to get intervention. And I think that's what this kind of research highlights. If you just let these kids sort of just flounder in the educational system, they will earn less, higher likelihood of winding up in jail, poor mental health and physical health. But early intervention and intervention in general is critical. So the more we help children learn skills to manage their impulse control, to manage their attentional difficulties, when they learn skills, there's better outcomes.
What are we talking about? Behavioral and cognitive therapy, or are we talking medicine? How do we help with ADHD?
Generally, it's a little bit of all of those things. I always want to start with, skill development, cognitive behavioral therapy, learning some skills for these young people. If that's not enough, and also accommodations in school. A number of these kids need accommodations. If that's not enough, there are medication options. Some of the medication options for an attention deficit hyperactivity disorder are some of the most well-studied and longest understood medications for our youth.
And really intervention at any point, because we're seeing a lot of adults get diagnosed, maybe because their kids get diagnosed and then they realize they had the same situation. But one of the questions we have from the Mom Squad is just a basic question. How do you know? What are the symptoms?
We're looking at 3 core symptoms, and that's inattention, hyperactivity, and impulsivity. So the core symptoms are in one of those 3 areas. And often I encourage parents to either make I don't always want comparison, but to make a comparison between your other child or to look around at other kids your age. If your kid's out on the soccer field and he's been given his position and yet he continually runs around all over the field and can't stay in his position, you're getting a bird's eye view that your child's level of inattention and hyperactivity is greater than his peers. So that's what you want. I mean, we have to take into account that kids have high activity levels. But what we're talking about here is a level of, either inattention or activity that is beyond what is typical development for peers.
And starting with your pediatrician, is that where we begin?
That's a great place to start because almost all children are connected to a pediatrician. School support personnel are really good at this also. I love it when you ask teachers because teachers have a really great developmental understanding of what is typical and what is atypical, because I don't use normal and abnormal. Those are judgments. So what we're looking for is what's typical and what's atypical.
Yeah, and we're going to take a deeper dive on the Kara's Cures podcast, how it presents sometimes differently in girls versus boys. Sometimes you won't see the hyperactivity as much, but also the testing. There's Vanderbilt forms, there's Connors forms. You're going to help us all with that, because I know a lot of people are saying, I think, but I don't know, where do I start? So we're going to get into that. It'll be a great podcast that people can listen to. Whatever podcast platform you like, just go to Kara's Cures.
I look forward to it.
Thanks, doctor.
Did you get your hair cut?
No, it's very curly because of the weather.
Okay, well, it looks good.
It looks good. I feel you, yeah.
Have a great day.
Take care.
Thank you.